Could you please tell us about breastfeeding and how long it should go for, long you should breastfeed, and when you should begin giving solid foods and 2% milk or skim milk or whatever?
That's a very interesting question, and I could talk for hours on that. But breastfeeding is nature's way of providing for the young. You can see the newborn babies born even before he or she opens his eyes. They're feeling for the breast. They want to feed. Okay? In French, they call them nourrissance, means nourishment, nourishing. They want to into nourishing. Okay? So what breastfeeding is something we encourage because all the protection against a lot of infections that you get in the bowel, the mother passes that protection onto the baby in the breast milk. All right? So that sort of protects the child. In addition, breast milk is clean, it is sterile, as opposed to if you have to prepare milk, there's always a possibility that it can get contaminated, the spoon isn't clean and what have you. So we encourage breastfeeding as much as we can. Now some babies will empty the two breasts and still wanting more. You think he wants more because babies can suck 24 hours a day. Because a baby sucking doesn't mean he's hungry. So that's why the pediatric dentists, they are not opposed to you giving a soother to the child because there's that urge to suck. Doesn't mean that he or she is hungry. They empty the two breasts and that should be fine. And the younger the baby, the more frequent they want to feed. If you've seen breast milk, it's like water. Okay, and if you forget or you have to go away for a while and the baby tastes the nice, creamy formula, sometimes it's very difficult getting them back on the breast. So I said to the mother, it's like giving you ice cream and then putting you back on diluted milk. So you do have to use baby formula sometimes to supplement if there's not enough breast milk, okay? But we advise or we encourage parents that the best way is up to 6 months. And when I'm saying 6 months, you don't let the baby feed on breast milk only, but you start adding cereals and other things gradually, but all the time you keep giving the breast milk. And when you're switching over, I tell you, parents, don't switch over to formula on a Friday evening, please. Okay? Switch over to formula on a Monday morning. Okay? Because for the rest of the week, if the baby has problems, you have doctors all over the place, you come to emergency. If you switch it on a Friday evening, you switch it on a Friday evening, the baby have tummy ache, he has upset, he's vomiting and diarrhea, and they spend their weekend in emergency. So I say, switch it on a Monday morning, whereby you have more help and everything like that. Now, just to hone down on the 1% and 2%, the nutritionists advise baby should not be on skim milk. And up to the age of 3 years, sometimes they say 2 years, sometimes they say 1.5 years, but up to the age of 3 years, your baby's brain is using the essential fatty acids that you find in milk. So if your baby's brain is to grow and to work well, when they're laying down the basic structure of the brain cells and the brain tissue, they need the essential fatty acids in the full cream milk. So we discourage them from using the 1% or the skim milk or the 2%. They should use the full cream milk.